Yo, penonton sekalian, I'm a champ. Anyway, today we are going to talk about something that I wish would just go away. It's not going away, it's staying. This thing is called COVID-19. And let's just say this lah. It's been around for so long now. It's not just about the sickness anymore. It's not about getting sick and feeling bad. This COVID-19 infection can mess up your daily life and can mess up the lives of your loved ones. So because it's not going away, like that one friend who refused to chow, even though everyone has left already, we have to talk about it. I've gathered two experts. I've got Dr. Sanjay and Dr. Tan. Thank you for coming and sharing your knowledge with us. So, like this lah. We know COVID-19, pretty much quite a lot about it. The problem is the information can trust or cannot trust. Because some information, yeah, quite useful. Some information, just downright creative. I don't know who invented this thing. How do I tell which is legit?
Douglas, excellent question. I face this all the time. I think universally, all of us, information overload.
Correct.
The first thing you ask is, where is your source of information coming from? Is that source credible? That's critical. Because if you go to a source that's trusted, you're going to get accurate information, you're going to get up-to-date information.
So what are examples of these sources?
Really things like going to websites such as Center for Disease Control in the US, the WHO, even our own Ministry of Health websites give you excellent information. And you find that even difficult, speak to your local doctor, your local healthcare professional. They can help you.
So because COVID is not going away, and so we have to still, be vigilant. I've got a personal story. So, I'm a comedian, so I do gigs. And there was a good weekend. I had 3 gigs lined up, Thursday night, Friday night, Saturday night. One of it was for a birthday of a 70-year-old man. His son knew his father was a fan, so he thought it'd be nice I go there, tell some jokes, celebrate his father's birthday. On Tuesday, I started lah. Bit of headache. So I thought, no, please, no. I tested double line. So this is what I did. I told management, call them, we have to cancel. And why? In my head was like, this is a 70-year-old man. I didn't want to go there and might give him COVID on his birthday. So we cancelled all the gigs now. So I guess I was still being vigilant, but it cost me 17,000 ringgit. My question is, did I do the right thing, doctor?
Well, your pocket's lighter, but I think you made the right decision. If you're young and you're healthy, right, and you've been vaccinated, right, to you COVID may be like a cold, like a viral cold. But the issue about COVID is that, and this is, we deal with people who are sick, people who have other diseases which we call comorbids, right? So I deal with kidney disease people. So they have a poorer immune system. So what happens is that if we are sick and we pass this flu to them, right, inadvertently, they may not be able to withstand it as well as we do. So it's all about protecting others. It's all about protecting the people who are older, the people who have poor medical health. And so I think you absolutely did the right thing.
So I guess we can say that when you try your best to not be so selfish.
Yeah.
Even though you think it's not a big deal.
Yeah.
Help out now.
Yeah, I mean, you want to protect. I mean, we live in a society, so it's not just about us. It's about everyone else that lives in that society as well. So while we may be healthy and we may be able to withstand the challenges of this kind of virus, but we want to make sure that we don't pass it along to someone else who might not be able to withstand it.
Dr. Tan, taking from what you said just now, because COVID-19 symptoms are very similar to a flu, right? Okay, and so for some of us we can handle it. Just take some coconut water, take a nap or whatever. But because it's not, it's actually a serious disease. Dr. Sanjay, when or how can we, when we feel a bit uneasy, go, let's not be so relaxed about this and actually go and check with our medical professional?
Another good question. Thank you, Douglas. Really. I think if you are unwell with high fever, get tested early, especially if you have a comorbid. Now, really is this. Every day I see children coming with fevers. And it's of course impossible for parents to know whether this is a COVID-19 infection or not, because COVID-19, as you quite rightly said, is identical to any other virus, including influenza. The red flags to look out for when you must come to see a doctor when your child does have a fever is this.
Okay, red flags, huh?
Red flags.
Red flags.
The important one is number one, If your child does not respond to fever medication, within 3 to 4 hours, they're still lethargic or tired, come in. If the fever goes on for more than 2 or 3 days, come in. If your child has coughing with breathlessness, has chest pain perhaps, lethargy, not feeding well, or even a lot of sleep disturbance.
We know that there are treatments available now, like a far cry from what we had back then, right? For adults, how, Dr. Tan? I mean, I'm guessing that we've also made a lot of progress in that part.
Well, I think these COVID treatments, right, they're generally safe. But I think the key is that if you do get detected as COVID-19, if you do self-check and you do find out about it, the key is to go get seen by a doctor a bit more, quick, right? Because you want to get it seen fast so that he can decide whether you would qualify for some of these, treatments that are available out there.
Okay, so it looks like we talked quite a lot about something we don't want to talk about. I hope that has cleared up some of our nagging doubts about COVID-19. A big thank you to Dr. Sanjay and Dr. Tan for sharing with us your insights. I think the bottom line is this, okay? Everybody, we still need to keep our guard up, can't afford to relax. Stay safe out there and look out for one another. Semua jaga semua. It's a fact of life. Okay, next topic. Triple vasectomy.
That's a real thing.
You must be blessed.
I don't know what I'm talking about.